Good morning, everyone. Today I am going to discuss about the topic oral habits. These are the contents: simple introduction, definition, classification of the habit, development of the habit, and common oral habits. So, coming to introduction, oral habits may be a part of normal development, a symptom of a deep-rooted psychological disorder, or may be a result of abnormal facial growth. And these habits apply harmful unbalanced pressure on the developing craniofacial skeleton and may result in deranged malocclusions. So, coming to the definition, Dorland defined habit as a fixed or a constant practice established by frequent repetition. Another definition of the habit is a frequent or a constant practice or acquired tendency which has been fixed by frequent repetition. According to Matthewson, habit is defined as a learned patterns of muscular contraction. According to Boucher, habit is defined as a tendency towards an act that has become a repeated performance, relatively fixed, consistent, and easy to perform by an individual. Now, next we move on to the classification of a habit. Habits are classified mainly into useful habits and harmful habits. And Kingsley in 1958 classified habits as functional habits such as mouth breathing, muscular habits such as tongue thrusting, postural habits such as chin propping, and combined habits such as thumb sucking. Another classification of the habit was given by Morris in 1969 is pressure habits such as thumb sucking, lip sucking, and tongue thrusting habit, non-pressure habits such as mouth breathing, biting habits such as nail biting, lip biting, or pencil or pen biting. Another classification was given by Ernest Klein, 1971, as intentional or meaningful habits, unintentional or empty habits. Now, coming to the development of habits, habits are acquired as a result of repetition. In initial stages, they are conscious effort to perform the act, and later this became less conscious. And if repeated often, it enters claims of unconsciousness. Now, the trident of habit. The deleterious effect of habit depends on the three factors such as duration, frequency, and intensity. And later on, Pinkham added the fourth dimension as direction. So, the trident of a habit are intensity, frequency, and the duration. Now, coming to the common oral habits, they are thumb sucking, tongue thrusting, mouth breathing, paroxysm, nail biting, lip biting, and self-injurious habit. Today we will be discussing about thumb and digit sucking habit. Thumb sucking habit is most commonly seen habit in children, and it's of a concern to specialists such as psychiatrists, pediatrician, pediatric dentist, orthodontist, speech therapist, and plastic surgeons. Thumb sucking is defined as a placement of a thumb at various depths into the mouth. And digit sucking is defined as a placement of thumb or one or more fingers at varying depth into the mouth. So, till which age thumb sucking is considered normal? Till the age of 3.5 to 4 years, thumb sucking is considered as normal and does not generate any malocclusion, and it disappears as the child matures. Now, coming to the classification of thumb sucking, Septenley in 1973 classified thumb sucking as type A, type B, and type C, and then type D. Type A is seen in 50% of the children, where the whole digit is placed in the mouth, which is pressed against the palate, and having anterior tooth contact present. Type B is seen in 30 to 24%, and this does not touch the palate. Type C, it is seen in 18% of the children, and type D is seen in 6% with very little portion of the thumb in the mouth. Etiology of the thumb sucking is mainly sucking reflex. Sucking reflex is the reflex in 29th week of intrauterine life, and it is the first coordinated muscular activity of an infant. This is mainly caused due to psychological and nutritive needs, and it learns enjoyable sensations. Now, the positive factors for thumb sucking are parental occupation, socioeconomic status. It's most commonly seen in working mothers, which leads to insecurity of the feeling. A number of siblings and divided attentions and birth order of the child. And coming to the diagnosis of the thumb sucking, it's mainly due to by taking a proper history of the patient, by checking the frequency, intensity, and duration of the habit, and feeding patterns, and the presence of other habits. Extraoral examination, we can see the digits having clean span of the thumb, and lips will be short, hypertonic hyperlip, hyperactive lower lip, seen during swallowing. Extraoral examination, patient form will be hyperactive mentalis, and other features are mouth breathing, tongue thrusting, and enlarged tonsils. Coming to an intraoral examination, we can see a proclined upper anteriors, diastema may be present, retroclined mandibular anteriors, and buccal crossbite. The most common seen in intraoral feature is anterior open bite. Next is constricted maxillary arch, often is associated with posterior crossbite and tongue thrust. Coming to the treatment consideration, first we have the psychological status of the child should be assessed, then age of the child, motivation of the child, and parental concerns. Now the treatment depends on the three parts: psychological therapy, reminder therapy, and mechanotherapy. Psychological therapy, check, you have to check under the psychological disturbance of the patient, make the child aware of the habit. Reminder therapy, we can use certain appliances such as extraoral approaches, such as hot and bitter tasting, that's application on the skin and nail of the digits. Reminder therapy include extraoral approaches such as thermoplastic thumb post, ace bandages, and other is intraoral appliance, which consists of reminder therapy is removable appliances and fixed appliances. Removable appliances can be used fixed tongue grip, bluegrass appliance, or fixed spike. Bluegrass appliance, which was introduced by Haskell in 1991. It consists of a Teflon roller which slipped over the stainless steel wire. It is soldered to the molar bands. Another treatment option is quad helix. It prevents the thumb sucking as well as the correction of malocclusion by maxillary expansion. That's all about thumb sucking. Thank you.